Hi, and welcome to our series explaining the complexities behind provider terminations and what they mean for member healthcare. I'm joined today by Erika Stetson, who will talk about what regular care needs look like when a provider leaves a network. Thank you for being here.
Thank you, Elaine. I'm happy to be here as a resource.
So can you briefly explain the difference between in-network and out-of-network care?
Sure. Members will pay more when they receive care from a provider who is not a part of their provider network. This is what we call out-of-network care, and these providers are ones that Premera does not have a relationship with.
Got it. So what does this mean for health plan members in the wake of a provider termination?
All of the provider's facilities would then be out-of-network. These facilities include urgent care locations, primary care clinics, specialty care facilities, medical centers, and all providers and healthcare professionals practicing at facilities run by this provider. This means that any non-emergency services received at one of these locations may cost more out of pocket.
What if a member has a long-term treatment plan at a facility run by the terminated provider? How can these members navigate their care after the termination?
For Premera members, receiving treatment for a covered, serious, complex, or chronic medical condition with a terminated provider may qualify for continuity of care benefits. This includes pregnancy, long-term or chronic illness, or a scheduled non-elective surgery. If approved, they can continue their care at their facility with their provider at the current in-network benefit level for up to 90 days.
If you have questions about continuity of care, please contact our customer service team for more information about this process and the timeline associated with it. So ultimately, the loss of a provider from a health plan's network will affect everyone differently. Sometimes a county will have limited provider locations. If those providers are lost, would members in that county have any issues accessing a hospital? Would there be any network adequacy issues?
While I can only speak for Premera, here we believe it's critical to provide access and choice for our members. If we are faced with provider terminations that threaten access to care, we have contingency plans in place to fill the necessary gaps. Some of these measures allow members to pay in-network costs at out-of-network facilities. Emergency care services are not affected since members can get care at any emergency room at the in-network costs thanks to a law called the No Surprises Act.
Before I let you go, how can a member verify if their primary care provider is impacted by a provider termination?
Great question. To find this information, members can use our Find a Doctor tool or call us at the phone number listed on the back of their ID card.
Thank you, Erika, for your time. We really appreciate your insight into this topic. Please watch our other videos to understand more about provider terminations and how they affect members. To find a new provider in your network, sign in to your account on Premera.com. Under Find Care, you can use the Find a Doctor tool that Erika mentioned. Thanks for watching.